In today's video, I'm going to be covering an entire program of mobilizing, stretching, and strengthening level 1 to address sciatica. Okay, I'm going to be starting with the mobilization first, and what I'm going to cover today for this level 1 video is the most common scenario that I see for folks who come in with sciatica, which would be low back pain that radiates down one or both legs, usually down the back of the leg. A lot of times it stops right around the knee. It can go further down into the calf and all the way to the foot as well. I need to explain one thing first, which is directional preference. So in this scenario, I'm assuming that what is most commonly too is a person with this type of pain is usually triggered with flexion or bending activity. So if I'm sitting, like I'm sitting right now, for a prolonged time in the car, or it could be at work in an office chair or any other type of chair, and perhaps even I'm sitting in a chair that doesn't allow me to have good posture, or I'm slumped in the chair and my low back is flattened against the chair. So I would be kind of rounding that normal lordotic curve and rounding the low back for a prolonged period of time. That can be a very common trigger. Another activity that could be a common trigger for this would be repetitive bending. So if I'm out working and doing yard work, bending over in the garden, or perhaps even going to the gym. A lot of gym exercises like deadlifts, good mornings, bent over barbell rows, things like that. Even some exercises where you're sitting in a machine, which could allow you to sit in maybe not the best posture with resistance and weight on top of that, can trigger this type of pain. Now, what you want to do is think about moving in the direction opposite of the direction that triggers the pain. So if flexion is the trigger for the pain, what we want to do is move into extension. And so we're going to start with this one by simply laying flat on my stomach, and this would be the first position. I would stay in this position, or you'd want to stay in this position for 2 to 3 minutes. And just what you're looking to see is, does the pain in your leg, so assuming, say I had pain down my left leg, and it was down maybe across the glute and the buttock, going down to the back of my thigh, does the pain start to decrease or move away from the back of my leg and start to travel up towards my back? That's called centralization, which is another key term. If the pain starts moving toward the back and dissipating or going away at the leg, it's centralizing. That's what you'll be looking for. Now, the other thing is the pain could just be decreasing as well, but it should be changing. And so starting in this position, 2 to 3 minutes, then I would move up into this position where I'm just laying with my elbows and my forearms. My elbows are right underneath my shoulders. My forearms are just flat on this. It could be a bed, a mat, or a table like this. And I would be staying here for 1 minute, roughly, and then maybe coming back down, laying in this position for about 30 seconds or so, and then coming back up and doing this 3 times. So in this sustained position, I'm getting a little more extension and trying to see how is the pain, how is my sciatic pain being affected by this positioning and by this movement into extension. So if you're starting to feel, if it's not doing anything, we'll go to the next level. If it's starting to dissipate a little bit or at all, or even temporarily, or moving towards the back, getting that centralization, we're going to go to the third one, which is called the prone press-up, where I'm going to have my hands along the side of my shoulders, kind of like you're doing a push-up. I'm going to relax my low back. It's not doing anything at all. My back muscles are completely relaxed, and I'm using all my upper body to start to press up, looking straight ahead. Brief pause for a second or two, and then coming back down. So I would do one and just see, again, kind of a tester, see how it goes. If I'm feeling like didn't really unaffected, or I feel that temporary centralization, I'm going to go ahead and do 10 of them. And each time I'm keeping my hips close to the table, relaxing my legs. Each time I come up, I'm going to go just a little bit further. So if I get up to like number 10, I might be going as far as I feel like I can go to get to what I call my in-range position. Relaxing and sagging this low back as I come up and looking straight ahead when I get to the top and coming back down. Now, if you feel maybe even a temporary relief of the leg pain, even if it comes back, that's still a good sign of centralization. Now, if you do that for 10, maybe 15 repetitions, two things you're looking for, two very important things. So I call it the 2 thumb up rule. Thumb up number 1, if your pain starts to move out of your leg and towards your back, even if you had back pain, that's still centralizing. So that would be 1 thumb up. The other thumb up is if you are able to do a forward bend, or if you're able to move more freely, or if you feel like the flexibility or range of motion loosens up. So if you get better range of motion or flexibility or movement, it feels like it loosens up, that's a thumb up. If you get centralization or that pain starts to decrease, that's your other thumb up. If you get 1 thumb up out of 2, I'd still keep trying it. And for this one, you would want to do this exercise every 2 to 3 hours. So maybe 10, 2 sets of 10. If you feel like it's really starting to work, you could even do 2-3 sets of 10, but pretty frequently throughout the day. So every couple, 2 or 3 hours, somewhere between 5, maybe 6, 7, 8 times a day. And if you'll see a pattern. So what you're trying to do is get the pattern so that every time I do this exercise, this mobilization, this self-mobilization, that pain pattern starts to go up towards the back, the leg pain gets less, my flexibility or my range of motion gets better. And you would also want to try to avoid sustained postures where you're not, or where you're rounding your low back or doing a lot of forward bending activities. So that would be the mobilization number 1. The next thing I'm going to talk about is the stretching. So for the stretching part, I would start on hands and knees. Now again, I'm going to stretch the left side, so I'm going to bring this knee up and keeping my back straight. I'm going to lift this leg up. I'm going to turn this foot in, and I'm going to move my hips over so my knee is somewhere in the middle of my body. Then I start to slide this back leg back, the right leg. Now if I want to maintain a little bit of extension here or not round my low back, I might just start right here. And this is called the pigeon pose or a pigeon stretch, where I'm going to hold this position for about 30 seconds to a minute. I could do both sides, but if I was trying to work with sciatica just on the left side, I would stay on this left side. If I felt I could go a little further, I can move it back. If it releases even more, without rounding my low back, I can come down here and start to get closer on the forearms and really feeling that stretch through the glutes. It does stretch across the piriformis muscle, which is one that is often tight or has trigger points in it with sciatica. And then releasing right here. So I'm going to go on to the strengthening part of it now. Now the strengthening part, again, is going to be in prone. So this is an extension-based program. So if I'm laying flat, have my feet off the end of the table, I'm going to put my hands up here. And for the first one, it's going to alternate leg raise. So I'm going to be strengthening the glutes. That's the muscle you want to target for strengthening. So it's going to lift the right leg up, pause, bring it back down, lift the left leg up, pause, bring it back down. So I'm alternating leg lifts, squeezing the glute as I come up, trying to extend through the hip. My back is pretty straight, maybe just a slight bit of extension because I'm laying on my stomach. And you're going to want to do 3 sets, 10 to 15 repetitions on each leg. Strengthening, you want to do that about 3 times a week, maybe every other day. The mobility and stretching every single day. And again, that first one, multiple times a day, until you feel like you've got significant relief from the sciatic pain. Second one, Strengthening is going to be with a bent leg. Lifting up, you're not going to get quite as high. But this one, I would usually do all on one leg, all on the left leg and all on the right. I'll demonstrate on the left. This one's going to activate more just the glute max, whereas the first one you're getting some of the hamstrings as well. Then go the right leg. I'm squeezing the glute, raising the leg up in a bent knee position. Last one, I'm going to target the upper back, the thoracic spine, the thoracic extensors. For this one, I'm going to have my hands down here, palms up. Next, I'm going to turn my palms down for this one. Lift my chin up. I'm trying to slide the hands down the table. So depending on how much mobility you have, it could be a fairly small motion, just an inch or two, and then coming back down. Resets 10 to 15 reps of this one. And this is thoracic extension. I'm just sliding down, lifting my chin, and really targeting the muscles here that extend your spine, the thoracic paraspinals. And that's it for the level 1 strengthening for sciatica. Okay guys, that is the level 1 video for fixing your sciatica pain. Please like and subscribe. Also on the link below, it will be a link to our Facebook page where I'm on there regularly to answer questions and discuss these things in greater detail. If you go through the mobilizations in particular and you're getting, hopefully one thumb up, one thumb down, or it just doesn't seem to be having too much of an effect, or in rare instance, you have a different directional preference, check out my level 2 video, and I'll be going through some alternate directions of movement. So in case, this is not giving you the 2 thumbs up that you're looking for, there are different directions to move. And I will say also that, in the research on sciatica and low back pain with radiating pain, a lot of people do have a directional preference. Not everybody does, but it is so common for people to have it that I see that it is the first place you want to start to figure out is what direction to move your back to make your symptoms better. Because remember, movement is medicine. Take care.